Hey everybody, it's time for Avian First Aid, Episode 11. This episode is going to deal with the types of burns, chemical burns and thermal burns.
So the next category of emergency that we see is burns. And you can have thermal burns, which is by heat, or you can have chemical burns where they would be exposed to a caustic chemical. The most common burn that we see is on the feet, and it's in the kitchen. For some reason, birds think that those little burner things on top of your stove are perches. And many times, birds that are flying in the kitchen decide to land, and you shoo them away from your cookie dish or whatever, so they land on there. And the unfortunate thing is when they first feel the burn, unlike us who pulls away, lots of them grip tighter first and then let go. So bottoms of the feet are a common area where I'll see burns. I've also had birds who flew into a kitchen when there was hot soup and landed in it. Hot floor water if you're doing floors. So if there are things that are going to be, that you're doing with your bird, don't do them in areas where there's heat. My bird gets to come with me when I'm mixing the cookie dough, but as soon as I start baking, he is back in his cage, because I don't trust that one day he might not decide to hop down when I'm taking cookies out or whatever. Crop burns are another type of burn that we'll see, and that would be in a baby bird that's being hand-fed and the formula is too hot. Because when they're motivated to eat, they glug it down way before they realize that it is too hot. Particularly if you're using microwave to heat your formula, it can have hot and cool spots. So even if you have a thermometer and you put it in and it looks like it's good, over here there could be a hot spot. So be extremely careful with that. And our hands that we use every day to do things, you know, to touch it isn't a good indication of how hot it is, because this skin is pretty thick compared to crop. So you want to either take the temperature, and it should be 110 degrees like you would do a baby, or you know, you can touch it to some more delicate skin on your wrist or on your lip to assess it a little bit better before you feed the babies. Burns, usually when it first happens, it doesn't look too bad. Burns get worse for 2 weeks afterwards, because as the tissue that's been burned dies, it lifts blisters off and sloughs out. Initially, if you see it happen, what you want to do is cool it down as much as you can, as quickly as you can. So running it under cool water to drop the temperature of anything that, you know, could be in there deeper for a minute or two is probably all that is going to be of benefit after the burn happens. Then what you want to do is a bunch of that burned area, the skin is probably going to peel off. Not right now, but it will. So you want to protect the body from losing a lot of fluid, because the skin is a barrier to fluid loss. So that's where your dressings come in. I like using non-stick dressing, which is the Telfapad. And the one that I like the best for burns is Silver Sulfasalazine is the generic name for it. Flamazine is the trade name, and it's used in burn patients in people. It moisturizes, it has an antiseptic effect, and it reduces scarring as well. So that's my favorite one specifically for burns. You can use it for other things as well, but it's expensive. So, you know, it's probably not a huge advantage for other things, but that's the best treatment. Then put your dressing on, and you're probably going to want to change the dressing initially in 3 days, again in 3 days, and then you kind of are going to know where you're at. If it's mild and there's just a tiny little bit, that might be enough. It might be healed by then. If it's extensive, you're going to be doing dressing for months, because it takes a long time to cover up a burned area. With a crop burn, usually what happens is nobody knows that it happened until a week or two later. They start seeing formula draining from here on the baby. And the reason is when they open it up, they see this big scab. Well, what's happened is a piece of that has burned from the inside out, and now when you put the formula in, there's a hole from the crop to the outside. So two things. You need to wait until you're sure how extensive that area is before you suture it up, because you can't tell for sure how much tissue is dead for 2 to 3 weeks. And if you suture dead tissue, it just falls out and so do your sutures. Sometimes, if the area is extensive though, you might have to suture it once and then redo it later. The reason is that you have to keep that bird alive and he has to be able to eat. And if the burn is really extensive, any food that he eats just falls out and doesn't get into his system. So you may have to stitch up what's there, continue feeding him, and then as more sloughs out, stitch it up again. So obviously the prevention on that one is take a lot of care with your formulas. It could also potentially happen with a bird who swallowed something caustic like Drano. Usually they wouldn't eat enough of that, and usually if they had those kind of chemical burns, it would be predominantly in the mouth. It wouldn't get as far as the crop. Chemical burns, cleaning solutions, you know, that type of thing would be what they would get into. It can be on the feet if they walk in them, or sometimes birds are curious and they will chew or bite things and get it in their mouth. If you see it happen, the immediate action is to get as much of it off the body as possible, as fast as possible. And using soap is a good idea because some of these things are a bit oily, and just running them under water isn't going to get it all off. So wash it up as good as you can, and then I usually don't wrap those until I know how extensive they are. They're usually not as bad as thermal burns. If they're in the mouth, don't use soap. You wanna just rinse it out with as much water as you can to get it off the tongue and around. And usually, if you're rinsing a bird's mouth, you don't want him in this position because if he starts to choke and sputter, it'll get in the lungs. When I'm rinsing it out, I usually hold it over a sink and rinse it so that it just falls down, because that way it won't get into the lungs.